Worrying news of almost 22,000 new COVID-19 infections reported yesterday. A further 392 deaths were reported over the same period. With holidaymakers returning home from hotspot areas, those numbers are likely to continue rising. So what more must be done to curb the spread of the virus? And what are the implications should this not be done as a matter of urgency? For more on this, we're joined by Stellenbosch University's public health medicine specialist, Dr. Kerrin Begg. Thank you so much, Dr. Begg, for joining us on eNCA. Now, of course, so-called super spreader events have not been permitted for about 2 weeks now. That was what a lot of government officials were saying was the reason for our spread. But now 22,000 yesterday, I don't think we've ever recorded such a huge number. What are we doing wrong?
So I think what we need to remember is that it's the things we did 2 weeks ago that are causing the infections now. So we'll only reap the rewards of the additional restrictions 2 weeks after they came into being. So we are, we're still in the midst of that. So we're still experiencing the Christmas upheaval in terms of social gatherings and crowded spaces. So we just need to remember that that COVID manifests after 7 days to up to 10 days, and so we really are only going to see those the advantage or the impact, the positive impact of that kind of starting now. In terms of what we need to be doing, we really need to be getting back to basics. We need to understand that this virus does not have its own legs. It doesn't fly. We give it to each other. And we only do that when we engage with each other as human beings. So as humans, we give the virus legs. And we need to stop doing that as much as possible. Whatever the government restrictions are, we should be doing more. That's really the base minimum to keep the economy going and to balance the protection. But if we're able to do more, we should be doing more. We should be staying home. We should be wearing our masks at all times. We should be washing hands regularly throughout the day. And coughing and sneezing into our elbows, into our tissues, and really just understanding that, it's a bit like a child and glitter. Once one person has glitter in the room, everybody's got glitter. And so we really need to be making sure that even though we can't see it, we need to be expecting that each one of us behaving as if we have COVID and making sure that we don't spread it further. That's probably more important than trying not to get it ourselves or thinking that we're invincible, but actually rather pretending that we have COVID and make sure that we're not spreading it to others.
So putting ourselves on level 5 lockdown, basically, as individuals. Now, Doc, there is also people who, for instance, on social media, because of the shock that they are going through with these numbers, saying that they don't believe the numbers, they believe government is cooking the numbers because they want to scare us. But surely it could be because, also another attributing factor could be because of the traveling and the rule that you need to test when you're traveling out of the country or coming in. That's making more people test right now.
Correct. So remember that the numbers are a factor of what we count. And invariably, we are undercounting. We know that as epidemiologists and public health specialists. We know that invariably we are undercounting. So there are many more people who are positive than those that we are testing. And so because of being asymptomatic, or, for instance, one member of the family testing, becoming positive, the rest are all symptomatic, assuming that they're positive appropriately. And then, but actually we're not counting the full numbers. So we actually have far more than the 20-odd thousand that were diagnosed yesterday. And so we do need to be scared. And the only thing that's really going to get us out of it is our behavior, followed by vaccination, massive vaccination when we can get it.
Now, the news about the vaccination that we're receiving from India today by the Health Department, obviously something positive in that development. But looking at the fact that 1.5 million of the population will receive the jabs by the end of February, does that mean we can relax? What does it mean for the rest of the population?
So I think what we need to be clear on is that that first phase of vaccination is only going to be for healthcare workers. Our healthcare workers are under immense strain. I don't think that anybody has any idea of what strain our healthcare workers have been under for an extensive period of time. It has been relentless, both physically, psychologically, mentally, and many of them have been ill with COVID and are either suffering long-term effects or have had short-term being off and obviously worrying about their families, etc. So we do need to give some relief and reprieve to healthcare workers so that they can continue to treat the rest of the population. But until the vast majority of the rest of the population have the vaccine, we cannot, absolutely cannot, be anything other than extremely cautious.
Now, very quickly, Doc, I'm running out of time. Johnson & Johnson and their talks with our government about those 300 million doses that they want to be produced in this country. How important is it that our government uses this opportunity right now to negotiate for those doses to also stay here in our shores?
So I think that it's a long way off until there's a huge amount of technology, logistics that goes into the manufacturing and procurement and distribution of vaccines. I think that we're only likely to see that much later. I think that what we're really wanting in the world is to make sure that everybody gets vaccines, and hence the COVAX collaboration is so key. This is not about each country, fending for themselves. This is a world impact, and we need to be doing things from an equitable, health for all basis in the world. And it's an opportunity for us to really start delivering on our sustainable development goals, and particularly those relating to health.
Well, thank you very much for your time, Doc. Of course, that is Dr. Kerrin Begg, Stellenbosch University's public health medicine specialist.